Welcome, and my guest today is Adriane Burton, the Chief Information Officer of the Health Resources and Services Administration in the Department of Health and Human Services. Adriane, so good to talk to you again. Thanks for taking the time to join me.
Oh, thank you, Daisy, for having me today.
We're going to do a big catch up on several different pieces and parts of all the progress you've made over the last year or so, because I think it's been a year since we've talked last, maybe a little bit longer. So let me start always at the beginning. Let's get an update on your progress of how you're modernizing HRSA's technology applications, where you're at.
Well, just to set the context, so as you mentioned, HRSA is part of Health and Human Services, and we have over 90 programs. Our mission is to provide healthcare to underserved communities. We're primarily a grant-making organization. We have approximately 3,000 grantees. So in regards to where we are in terms of modernizing, we've been deploying additional software as a service solutions at HRSA, primarily to support the COVID-19 programs that we've been responsible for. And then we've been modernizing other applications along the way as well.
And I know, looking at over the last year or two, grant programs are getting a lot of focus. I know the administration is trying to get the grant lines of business, if you remember that, up and going again. So a lot of the technology that you all are probably doing will probably help influence those efforts. When you talk about software as a solution to support COVID-19, maybe talk a little bit about what those look like and how you're taking advantage of the cloud in that sense.
Well, we've been using software as a service for our Microsoft Cloud platform. We went to Exchange in the cloud many years ago. And then about 2 years ago, we went to MS Teams in the cloud. And then over the last 8 months, we've been deploying more of the Microsoft platforms in the cloud, such as the M365, as well as the OneDrive. In fact, we're still in the transition process for those SaaS implementations. And then in addition, we've been implementing software as a service for other applications, specifically for the COVID response. We implemented Salesforce to support the health center vaccination program. And we had 17 million people that were actually vaccinated with that program. And so we used Salesforce, and then we had some integration with some of the Center for Disease Control systems as well for that initiative.
And the reason why, obviously, when we talk about software as a service more generally, whether it's Microsoft or Salesforce or whomever, it's the ability to add more, to bring it down, add more instances when you need it, add more capabilities, the agility of it. That's really what's attractive when specifically around COVID-19, I imagine.
Oh, absolutely. I mean, we use software as a service for all of our COVID systems that we deployed, whether it be Salesforce, Snowflake, DocuSign, Tableau. So we definitely utilize the software as a service. It was a lot quicker for us to deploy systems that way.
It's amazing. We're always talked about this. What's the killer app, I think they used to call it, when it came to cloud or whatever it is. And it became, unfortunately, COVID literally and figuratively was the killer app for cloud computing in many ways. The other piece of this that you mentioned is aside from COVID-19, you also were doing a lot of modernization of some of the other programs. What other apps, how are you looking at that modernization effort? Is that also SaaS, or are you some stuff still kind of on-prem or using infrastructure? To discuss those efforts.
So we're moving more things off-prem using software as a service. We have on-prem Tableau data marts that's set up, but we've been moving more of those into the cloud, and we're going to be expanding some of our cloud offering in regards to data lake services. So we implemented some of those data lake services for the COVID response, and then we're going to be using that infrastructure to support other data instances.
I'm glad you brought up the data mart effort. There's also what is that? Because when I did some research, I know it's an enterprise data mart payment solution under the CARES Act. Is that the same one you're talking about, or is that a subset of the bigger data mart?
So that's the one that that I'm talking about. That was the one that we piloted for the Provider Relief Fund, which that fund was set up to help healthcare providers in the COVID-19 response. HRSA distributed billions of dollars in payments to healthcare providers. And then what we had After the money had been dispersed to the healthcare providers, of course, you have the flip side is that you have to implement systems for performance reporting. How was the money being used? And so we set up a Salesforce instance for the data collection for the healthcare providers. We use it multi-factor authentication for that. We also implemented Salesforce for our case management system for our provider relief program, as well as Tableau. So we initially started off with Tableau on-prem. And then we found out that it was more effective to move it out to the cloud. And so we moved the Tableau into the cloud as well.
I think that's the key here, as you talked about it, is when we talked earlier about the agility for COVID-19 on this data mart system, you realize not only was moving into the cloud a lot easier, but the change in direction. First, it was about getting money out, and then it was about tracking money. And you're able to kind of change that workflow, change that process right away, because obviously our discussion here today is about changing how the workplace works, or in your case, how your employees work. How has the cloud really kind of given HRSA a new approach to working, not just, hey, we can do it from anywhere, that's the easy one, but the process piece, like all the stuff we tend not to think about when we talk about technology?
Well, one of the things that we also implemented was Snowflake for a data lake for the Provider Relief Fund. And so we implemented artificial intelligence capabilities as well to help with fraud detection. We also implemented artificial intelligence so that we could go through the data and look for different patterns. And we use different technologies such as SAS, Python, R, RapidMiner. And so it's really has provided that foundational framework that we used not only for the Provider Relief Fund, but we're going to be expanding that data lake services for some of the other systems that have been more on-prem. We're going to be moving them out to the cloud as well.
And we'll talk maybe a little bit more about we'll spend a lot of time talking about the workforce and their processes, but let me take a half step back. As you kind of look forward over the next, 6, 9, 12 months, do you foresee more use of the cloud, I would imagine? And do you have a goal right now to say 80% of our workload applications will be in the cloud by a certain date, or how are you kind of measuring your progress?
I think it's really based on the applications. Primarily, we've been focusing on new applications and moving it out to the cloud infrastructure. We do have some work to move some of the existing applications to cloud, but usually many of our systems are a combination of different types of platforms. And then a lot of the different vendors are also moving the systems out to the cloud as well. So in some instances, you have to move out to the cloud anyway, because a lot of times different vendors are moving towards cloud solutions anyway.
It's interesting. So it's one of those times it sounds like that the technology you want to use is really driving your modernization. So much of this is already software as a service. Why would we bring it on-prem? That seems like that's really driving a lot of your efforts too.
I think the agility and really being able to rapidly deploy the technology. And then, as you mentioned, just thinking long-term, trying to make sure that what we're deploying are, modern and flexible technologies. So with deploying cloud capabilities is really our mission needs that are really driving that deployment, because we want to make sure that we're deploying systems using modern capabilities and flexible capabilities. And then what happens is that when we deploy, for instance, one system out in Salesforce, we find out that, okay, as new applications are needed, that we're able to leverage that same infrastructure as well, which is really helpful.
One of the areas that you talk about as well is the agility, and that agility, I think, fits into this broader conversation we're having today, which is automating your workflow, really adding more digital signatures. All of these kind of tools have you've been able to put to use because you're in the cloud, because you've made the investments over the years. So talk a little bit about how your workflow has changed and how the cloud pushed you forward to kind of above and beyond where you were 3, 5, 7 years ago.
Well, we deployed, for instance, DocuSign for a lot of the forms. For instance, when people are onboarded, we're using DocuSign for that process, so we don't have to fax forms back and forth the way that we used to before. In fact, we had started that initiative really prior to COVID, and then when we had to roll out systems to support the provider relief fund, we actually was able to leverage some of the work that we were doing for that particular initiative for the provider relief fund, because we already were using DocuSign. We were familiar with the technology, and that was really great that we were able to leverage that for the provider relief fund. So then we were able to leverage Salesforce, which we were using it for our contact center, but we were able to expand it to use it for performance reporting as well. And then we're going to be using Salesforce more so going forward with some of the different forms that we use for data collection from our grantees, because it's just a more flexible platform that can accommodate those changes quickly, but especially as legislation changes, some of those forms need to change as well.
Adriane, I remember when we talked about you all at HRSA implementing digital signatures and workflow automation. I want to feel like it's 2017, maybe 2018 timeframe. So when the pandemic hit in 2020, I think you all were in probably better shape than a lot of other agencies. I have to ask, did you get a lot of calls from other CIOs and from other agencies asking you how you did it, what advice you have, or was it all, just kind of head down, get the money out the door?
It was pretty much head down, get the money out the door. I mean, we had so many billions of dollars to push out that we were really kind of focused on, because that was a completely new program to HRSA. As I mentioned, we were primarily a grant making organization, and with the provider relief fund was more of a push payment type of program. And so we were really pretty busy for quite a long period trying to support that program, as well as the other things. I mean, it was a lot going on at one time.
Adriane, do you get a sense that you were well positioned before you used some of that technology because of all the work you did previously when the pandemic kicked in? Or did you have to not only sprint to get the money out the door, but you also had to sprint to maybe do some upgrades?
I think it was a combination. Some of the technologies we were already using at HRSA, which made it really helpful, or technology we had at least been piloting. For instance, we were already doing a pilot with DocuSign, so we were able to leverage that. We had some experience with Salesforce, mainly from a case management perspective, but not in terms of performance reporting. So I think that for us, we were using some of the technologies that we were familiar with, and then additional technologies as needed to make sure that we could do whatever we needed in terms of mission.
I think in some ways that's really important for you all, because you weren't just trying to implement new technologies that the workforce hasn't used before, that you weren't necessarily familiar with. Now, maybe more people used it, or they used it in newer ways, but, DocuSign, Salesforce, I've used that before. Okay, now I use this other piece. How much training did you have to do? How big did you feel like, in that first, 6-9 months of the pandemic, the first year of the pandemic, did you feel like you were, as a CIO, always putting out fires? Like, give me a sense of the impact on the workforce from this new technology, or the expansion of the technology.
I think HRSA was pretty flexible, because we were using tools such as Skype before the pandemic. And then when we upgraded to MS Teams and Zoom, I think that folks just really rolled with it. And then I think that they were just excited to have those technologies available, considering that, we weren't in the office, but we had so much work that we still needed to be able to do. And so I think that folks were excited about it. We got a lot of feedback in terms of, like, what do they need? I mean, we still solicit a lot of feedback from our users to make sure that the technologies are meeting their business needs. So I think that was, critical in the process. And then as well, HRSA is pretty automated in a lot of different things. And for the Provider Relief Fund, that was a whole new program, whole new systems, and then there were staff that had to be brought on board as well. And so it was just a combination of a lot of new things with the Provider Relief Fund that I think it made it more flexible. But we had different types of training, different types of, like, we were setting up the data mart, a lot of brown bag type of lunch discussions to talk about the data mart, what was working for them, what wasn't working for them. So I think really soliciting that constant feedback so that we could evolve as needed.
That's one of the key things I've heard time and again, and what the pandemic did. Again, I'll go back to my comment earlier about, we were always looking for that silver bullet, the magic bullet, the killer app, whatever we're calling it these days. And the pandemic forced that. Was that feedback with the mission side always there for HRSA? Was it something that happened on occasion, and the pandemic and the changes that you were making to the workflow processes, the new technology you're bringing in, force that discussion a little to happen more often, or at least on a more regular cadence?
we already had some of those processes and that framework in place. And I think that that made it really helpful. Like we have different stakeholder groups that are already in place. So when we needed to move quickly, we were able to leverage those stakeholder groups to bring like different problems that needed to be resolved to the work group so that we can have a discussion and then a plan to move forward, which I was really pleased with that because that just really helped to actually move things forward with that communication and getting that buy-in. So that was just critical, especially like trying to get our grants out. We were able to work with our health center program initially, and then as other programs needed to push our grants more quickly, we were able to have some of those lessons learned to leverage it for additional programs or different initiatives that came down the pipe. So there's a lot of collaboration that occurred throughout the process.
I think it's something that we're seeing time and again across all agencies that they had to kind of come together. They had to have more meetings. It's easier with Zoom sometimes or with MS Teams, right? You just flip up your computer like we're doing today, and we are having our conversation, and then you move on to your next meeting. Has that kind of kept going? Do you still have this regular cadence with the mission folks today, or has it lessened up a little bit because you feel like we're in a pretty good shape? Like how has the workplace changed from a technology perspective and a mission perspective?
I think that folks, of course, are using MS Teams and Zoom throughout the day, primarily MS Teams to have regular conversations as opposed to meeting in person. We do have people in the building as well. And so I think that moving from 100% telework to more that hybrid environment where you have some people in the office and some people at home. In fact, we've done a pilot of the MS Teams room in our conference rooms, and we're going to be implementing that in the next couple of months. And so that's primarily how we're communicating now from a hybrid environment. So we have some in-office type activities and some external. So it's just that constant hybrid because people come in different days.
Let me flip back over to the discussion about the workflow automation, the digital signatures for a second, because I think one of the big things about this is really part of technology is getting any organization, and this is a lot of times the CIO's job, to get the organization to rethink how they do their work. Did you have that in process already, or because these these programs were new, you were able to kind of clean sheet paper some of the processes? How did the workflow, the automation, the digital signatures impact kind of your processes more generally at HRSA?
I think for some of the newer programs, we had some folks that had worked on existing programs before that were able to provide some like a general framework for certain things, and then things were built over time to meet that particular program needs. So I think that that happened, and then we had certain things that were automated that in the past people would do like fax things, and then it went to the digital fax because we had to for COVID, but that technology was always there. But then there was a big push with COVID is to push some of that out more quickly.
And the other side of the coin, of course, is the grantees, the people, your customers. Did the technology also impact how the grantees work with HRSA? Did you see that change as well? Was it a harder change on them?
Well, we already had systems for our grantees to communicate with us. We did implement some additional systems, for instance, with the vaccination program. We use Salesforce for them to enter in data that needs to be provided for keeping track of the vaccinations. We also had some vaccination work that was being done through our rural programs, and we deployed Salesforce for that. So there were some new systems that we did deploy for the grantees to use.
And again, the same kind of question: are you able to apply the digital signatures? Are you able to apply the automated workflow to those grantee type systems?
Yes. Yep. Absolutely.
Which I know is such a big relief. I was, I think, filling out some doctor's forms recently, and they gave me the digital signature option, and obviously such a big difference in many ways. Were there some folks in your organization that offered a little bit of resistance? Were they doubters about the workflow changes and the digital signatures and things like that? Did you have some of that culture change?
No, I think a lot of folks were relieved that those solutions were in place, or that we could deploy some of those systems to support some of the things that may have been more manual. So I think that folks were really pleased to have some of those technologies available.
when we talk about the use of different technologies, digital signatures and other workflow automation, security always tends to come up, right? You all are dealing with a lot of important information, a lot of sensitive information potentially. And then again, you got to deal with payment integrity and things of that nature, guard against waste, fraud, and abuse. How did you address the cybersecurity challenges that came with using the cloud and or just came with maybe concerns about using the cloud? Maybe the cloud, a lot of times people say has better security. Can you talk a little bit about the cyber aspect of this kind of workflow and digital signature and modernization effort?
Well, for anything, we need to make sure that we're baking in security from the very beginning, and not just in the beginning, but ongoing, like with security, like tracking vulnerabilities. We have different scorecards, different things like that to make sure that we stay on top of security, as well as, patching is more than just deploying the system, because you deploy it in a secure, and then there's also maintaining it. Like I said, regular patching. We patch our laptops once a week. We patch our servers once a month. I mean, just you need to make sure that you have that framework so that you have your security baked in as you introduce new technology, as you need to make sure that these systems have their authority to operate as well. There may be opportunities that you can leverage some of the framework for an additional system so that it can leverage that ATO. And so those are some of the things that we definitely evaluate. And then there's some instances where we may use someone else's system. For instance, with the employee vaccination tracking, with that whole program, we opted to use the system that was deployed at the HHS level. There was no reason for us to deploy something that the department was deploying, so we were able to leverage that. So for us, we try to look at our portfolio, see if there's something that can be reused at the HRSA level. There may be some things that we can leverage at the HHS level. We also partner with NIH. They provide some of our capabilities for us as well. And then when we build new systems, is to make sure that security is baked in. And then for all the systems, you have that ongoing monitoring and management and oversight of security.
I was going to actually ask about that, how you partnered with others within the government or within HHS. I think it's really important that you all just weren't reinventing the wheel each time. Can you talk a little bit about how that relationship came to be? Did you call NIH? Did you call HHS? I mean, obviously the vaccination tracking system was something that we probably all heard about, but how did that effort come together a little bit more?
Well, with NIH, we've been a partner of NIH for over probably 20 years. HRSA has. They provide our network backbone, as well as our mobile device management, email, MS Teams, SharePoint infrastructure. So we leverage NIH a lot. And then for the vaccination system, the optives could either opt in with the system that was used at the department level or not. And we decided to opt in because it was easier. And there was no point in us, building something that we didn't need to build. And so we were able to just leverage that, which we were really excited about that.
A true situation where better, faster, cheaper actually was true.
Yeah. And we've leveraged NIH. I mean, this was years ago, but we used their electronic PMAP system. It was easier, quicker for us to just utilize a service that already existed, and then for them to onboard us. So we go through that process as part of our FTAR processes.
I want to go back to the automated workflows discussion for a second, because as we're talking about the grantees and the different parts of HRSA and then the enterprise services, maybe you're borrowing as well. When you talk about automated workflow and digital signatures, what are some of those benefits you've seen? How are you measuring savings or cost avoidance or just time saved? What are some of the metrics?
Right. So mainly what it is a lot of it is cost avoidance, because folks can focus the time on higher level things as opposed to some of the lower level activities that people performed in the past. So a lot of it is really a shift in the cost from more manual to the automated systems. But of course, the automation is not for free, so you need to factor it in as well.
But again, I think it's the type of thing where a lot of agencies see it takes 10 of us to do this manual process, or it could take one of us and those 9 other people could be over here doing that high value work. Is that something you saw during the pandemic? Did you have to, whether it's from a technology perspective or just from a mission area perspective, did you see folks kind of shifting and moving? Hey, your job used to be this Excel spreadsheet expert. Now you're going to do more of analysis type of work.
Well, we saw where we had to, especially with the grant process, we were able to really push out our grants a lot faster than what we had in the past. We would push them up between like 30 and 90 days. We were able to get it down to like 15 days, 12 days, 5 days. So that whole process, we were able to streamline it to get the money out the door as quickly as possible. And each time we did it, we were able to get better and better. And then some of the areas where people didn't quite want to automate it, but it was such a pain point, especially with the urgency of COVID, is that more and more got automated where folks said, well, I think we can automate that. That provided a great opportunity for things to be automated even more. So that was just really critical, I think, for us to be able to handle that workload in such a short period of time with some of that additional automation.
I always love that. Oh, well, I'm not sure I'm going to automate it. Well, wait a minute now. I'm seeing it over here. Maybe I do now. Any good anecdotes you'd be willing to share about maybe a process or something where I don't want to call folks out, embarrass anyone, of course, but anything that comes to mind where there's maybe some hesitancy, and then once they realized it, they were true believers?
Oh, we see that quite often. And this program, for instance, when we use Salesforce for the health center program, then we had our rural health program that needed to do something similar. And we were able to just leverage that very quickly for them to be able to do what they needed to do. And so that's when we have a lot of sharing of ideas within HRSA, which is really helpful.
When you talk about the savings and getting people to kind of believe that automation side and kind of accept it, have you done any sort of measurement of, oh, we are saving this much time? You mentioned getting grant time down from 30 to 90 days to 12 to 15 days, some as little as 5 days. Do you have any other data that you were able to share about how much time savings automation is helping you all?
Like with the time savings with the whole onboarding process, and that we had some numbers in regards to that. But there's just so many different things. Like we've implemented dashboards to help with trying to provide reporting to the White House for the vaccination program. They've just been we have been able to leverage that and really reduce some of the actual pain points with things like really taking a lot of time. And so, for instance, with the Provider Relief Fund, we were able to develop and deploy data marts to help with some of the reporting that needs to be done, a lot of the reporting. And then we're able to leverage that framework for instance, our health center program, and then for our rural health programs. And so I think that we've been able to, replicate that savings across multiple programs.
And meanwhile, I imagine your IT budget has maybe gone up a little bit, but has not gone skyrocketed up. And a lot of this automation, a lot of this move to the cloud, hopefully has helped you rethink your modernization to put resources in the right spot.
I mean, it's gone up in some instances, but not in others.
I think that's the story of every CIO's life in many ways.
Yeah.
We talked a little bit about security previously. Let me come back around to that because I think this is important of a discussion, because security of the data is important, but so is the accuracy. And one of the things that we know that by automating the workflows, by adding digital signatures, is you're also guarding against waste, fraud, and abuse. Have you also done any sort of measurement or looked at any of the benefits of how this automated workflow has really improved the accuracy, the transparency of your data?
There are different checks in regards to the program in terms of data accuracy, right? That's already implemented to make sure that, like, for instance, with the payments and different things like that, there will be different groups that do checks and balances of the data to check it for data accuracy. Some of that is within our group. Some of it is outside of our group.
From a technology perspective, are you trying to help them? Do they come to you with requests about, okay, how do we improve the accuracy? How do we, what tools do you have, or can we buy? Have you had those conversations much?
Absolutely. With some of the artificial intelligence and then some of the analytic capabilities for some of their data scientists to be able to look at the data and validate the data.
I imagine that's where you guys are such a big data organization. There's so much data you're bringing in that's where that artificial intelligence, machine learning is really playing a big role. Is that the next phase for you? Is that where you all want to go next to really continue to add value to how employees do their job?
Oh, absolutely. We have a data council that's set up at HRSA. And so there's a lot more energy and focus around some of the data initiatives. Of course, you have initiatives that have been going on all along, but I think looking at it from an enterprise perspective is definitely a focus. And we're here to make sure that the technology is there to support that enterprise approach.
Adriane, we talked a little bit about the next steps, right? The data council, looking at how to bring in maybe even predictive analysis, AI, machine learning. What are some of the other priorities you have from a technology, IT modernization, whether it deals with workflow automation or workplace or just more broadly?
Well, some of the things that we've been working on, of course, is data and expanding our data lake, and then setting up a model, like a service delivery model to support the various programs. So that's been a big focus for us. And then, of course, cybersecurity is always a big focus for not just HRSA, but all of the government agencies, especially with the Zero Trust, as well as this 853 revision 5. I mean, there's so many different security initiatives that's going on. So, of course, our priority is security and data.
And I imagine from the Zero Trust perspective, and I'm glad you brought that up, you're probably working closely with the HHS CIO and others. Is there anything you can give us an update from just the HRSA perspective of how you're moving toward that Zero Trust architecture?
I think really is trying to get our arms around exactly what needs to be done and evaluating what changes we actually have to make to our infrastructure. So we're in the planning process and the evaluating assessment process for Zero Trust, and trying to get on some additional contract resources to help us with that effort.
And I know there's a lot of focus from the Technology Modernization Fund. I'll throw it out there. Have you guys applied for TMF money? I'll just as a guess.
Yeah, so for HHS, we have something called the NEF fund as opposed to TMF. This is as part of I think it's part of the working capital fund, I believe. But anyway, HHS has something called a NEF fund as opposed to a TMF. And yes, we're utilizing that for some of the security initiatives.
Very nice. I think that's one of the people love to talk about the TMF, but it's those working capital funds that I think will really have the bigger impact. You mentioned expanding the data lake, service delivery model. Is this the type of thing as you're building on the kind of the current sets of technologies, or are you looking to bring in some new technology? Is there anything because we know a lot of vendors will listen to the show, so it gives you your opportunity to whether you want to hear from them or not.
Okay, so what we're doing is we're primarily using existing technologies, but setting up the framework for uses of that technology. For instance, we use Salesforce for the Provider Relief Fund. We're using it for expanding the use to more programs and more pieces of HRSA's programs. So I think for us is looking at service delivery models to be able to support the various needs.
Well, as we've tagged back to the beginning of the conversation, it makes it easier when you do need to be more agile, when you need to increase the number of instances or the amount of people using a specific system, and then bring it back down when things calm down. I'm sure you saw that throughout the entire life cycle of the COVID pandemic over the last couple of years.
Yeah, and what we try to do is deploy enterprise platforms that can be used by different parts of the organization, because that reduces our overhead and also integration with all these different systems. And so, for instance, we deployed Tableau early on at HRSA, and we just expanded the use of that throughout the organization. Now we're using Snowflake and expanded the use of that across the organization. So for us, we kind of lock in on the technology and then increase an adoption of that technology.
And the last piece here I just want to touch upon briefly is the workforce side. A lot of agencies are struggling to hire enough workers, to find enough workers, especially around things like cybersecurity and cloud architecture. Is there anything from a workforce upskilling, reskilling perspective, from a training perspective? Is there any initiatives you have ongoing that you're, okay, how do we fill in some of those gaps we may have?
I think that's a challenge for all of the agencies, not just within HHS, but of course within HRSA. We've been pretty lucky. We have a really great organization. In fact, we have really high EVS scores within HRSA. But I think that's just being in a beltway. I think that for us, what we've been doing is moving more to remote workers and some of the areas like cybersecurity. We have some folks that don't live in the Washington, D.C. area in order to try to pick up highly skilled folks. So that's something that we've been leveraging probably the last 2 years, that we're moving more towards remote workers for some of those highly demand positions. And that's been working out fine.
Which is great to hear, because I think that's something all agencies have really benefited from during the last couple of years, and are starting to kind of see that, hey, there's a big competition in the DC metro area, but maybe in Oklahoma or Iowa, there's less competition for these types of workers, and folks are more excited to be able to work from that from anywhere and come in once a month or once a quarter or something.
And some of these positions, we don't really need them to come in at all, right? That is right. We don't need them to come in on a quarterly basis, as long as the work is getting done.
And that's the key, as long as the work is getting done. And obviously you guys are doing a lot of work. Adriane, I've very much enjoyed our conversation. I really always love catching up with you, because you always are pushing the ball forward. So let me thank my guest. Adriane Burton is the Chief Information Officer of the Health Resources and Services Administration in the Department of Health and Human Services. Adriane, it's always a pleasure to catch up.
Oh, it's always nice to talk to you, Jason.
I'm Jason Miller, and for more from Workplace Reimagined, visit federalnewsnetwork.com.